Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Are you overlooking your eye health? Your eyes are connected to several systems in your body and can give you valuable insight into your overall health. And your overall health can help or hurt your vision. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Beth Brown, your host. Today we take a good look at eye health. Stay tuned. Welcome back to Healthy Living for Life. Joining us first this morning is Matthew Nottingham, a doctor of optometry. And thanks so much for being here this morning.
Thanks for having me.
So can you just start out by telling us what happens, or what are some common issues that happen as we age, and why do those common issues happen because of age?
Sure. So probably the first thing that people start to notice just with age is the fact that they need reading glasses. So usually early 40s, we start to see some of that. And that's usually what we'll bring patients in because they have a hard time reading, notes or computer material or computer distance material. And then after that, we start to develop things like cataracts. And then with age, we have a higher risk for macular degeneration, glaucoma, those types of things.
So since these things happen as we get older, should we see an optometrist more often?
Yeah, so typically we recommend people have eye exams once every year to every 2 years at the most. I tell most of my patients after the age of 50, I like to see them once a year, dilated exams once a year.
And why are those eye exams important?
Well, they're important, for eye health, and then obviously if patients are wearing glasses or contacts, we have to update those, make sure they're seeing as well as they possibly can. But just watching out for certain diseases, changes in their medical history can cause, certain eye problems to develop. So as like many things, as we get older, some of those problems tend to happen. So we want to watch out for those.
And so eye exams can reveal some of those other health issues?
Oh, absolutely. Okay. So, if somebody has elevated blood pressure, cholesterol, diabetes, certain types of cancers, any cancers really, but a lot of systemic diseases, immune problems, those can sometimes be detected during your eye exam, or we need to monitor for problems associated with those systemic diseases.
Okay. So you mentioned people who wear glasses or contact lenses. Should they see an optometrist more often than someone who does not wear those corrective lenses?
Yeah, anybody that wears contacts, we want to watch them, their eye health, and just with the contacts themselves being a medical device, we want to watch them on a yearly basis. Patients that have glasses, if they're healthy eyes, they're fairly young individuals, exam every 1 to 2 years is fine, unless they're, fairly nearsighted. We have higher risk of retinal tears, retinal detachments with nearsighted eyes. So I typically tell my patients every year they need to come in for a dilated exam to try and find some of those asymptomatic type tears.
Okay.
Yeah.
So we talk a lot on this show about why it's so important to know your family history and your own health history and keep track of all of those things when you talk to your healthcare professionals. Is that similar to eye health, and what should people keep track of?
Yeah, if I have a new patient come in, it's important for me to discover certain things about their eyes, but it also helps if they already know some of their own eye health and can relay some of that information to me before we even get started. But it is important. It makes sense to know as much as you can about your own body.
We talk a lot too about the impact that smoking can have on your overall health. How does smoking affect your eyes?
Well, smoking is pretty bad for you in general. For eye health, smoking constricts your blood vessels, which, we need our blood vessels to deliver blood, oxygen, nutrients to the retina, certain parts of the retina and the optic nerve. So if we're constricting that blood flow, there's higher incidence of, say, like macular degeneration. I think it's a 3-fold increase in risk of macular degeneration if you're a smoker. So anybody who has family history of macular degeneration or already has signs of macular degeneration, it's a pretty big deal for them to quit smoking, because that's one of the things that you can actually have. You can quit yourself. And being a 3-fold increase, we would want to want to nip that in the bud if we could.
Yeah, that sounds serious. So what about sleep? Sleep is also one that is important to a lot of different elements of your health. How does it impact your vision?
Sleep, good sleep is needed, mainly from probably the corneal standpoint. Getting good sleep helps hydrate the cornea and get oxygen to the cornea. So those patients that wear contacts, that's a big deal because wearing a contact all day impedes the amount of oxygen flow to the cornea. So taking those contacts off at night, going to sleep, the blood vessels from the inside of the eyelid deliver oxygen to the cornea. So it's important there. Also just for dry eye patients, which in Montana we have quite a few of those, keeping the cornea moist. So good sleep is helpful for dry eye patients also. Okay,
that makes sense. And you talked a little bit about blood flow and the importance of that. And another thing that happens to a lot of folks as we get older is blood pressure. I mean, so how does blood pressure, if someone has blood pressure, should they be thinking about their eye health?
Yes, blood pressure, elevated cholesterol, all of those kind of go hand in hand together. So, from an eye standpoint, we can see if somebody has elevated cholesterol looking at the cornea. There's certain signs that we can look for looking inside the eye at the retinal vessels. We can see if there's plaque buildup. So keeping in touch with your primary care provider, keeping your blood pressure low, keeping your cholesterol in check is really important. And we like to send feedback to patients' primary care providers if we're seeing issues like that with the retina. So I think anybody that has issues with cholesterol or elevated blood pressure should come in for an eye exam at least once a year.
Okay. And we have time for maybe one more question. You talked about cataracts earlier. Yep. Why do cataracts happen?
It's one of those fun aging processes. There's different theories on exactly why a cataract develops, but it's mainly because of oxidative issues and things like UV light affecting the lens. I tell most of my patients, you live long enough, you're going to get cataracts. At this point, that's the way that it is. But there are some things that you can do to decrease your oxidative stress in your lens, like wearing sunglasses, polarized sunglasses, not smoking, having a healthy diet.
Okay, great tips. Yeah. Thank you. So we do need to pause here for a quick break. But if you have diabetes or pre-diabetes, you won't want to miss our next segment. Stay with us. We'll be right back after this short commercial break. Welcome back. Having diabetes or being at risk for diabetes can increase a person's chances for developing other health problems, including eye problems. We're continuing our discussion on eye health with Dr. Nottingham, and thanks again for being here.
You're welcome.
So I read that people with diabetes are actually 60% more likely to get cataracts. Can you talk about how diabetes affects the development of cataracts?
Yeah, like we were talking earlier, most people, if they live long enough, they'll develop cataracts. We tend to see cataracts develop in younger patients that are diabetic, mainly because the glucose, the ability to try and manage the glucose levels can affect the lens. So if somebody has elevated glucose levels at really high for a few weeks or a few months before they're even diagnosed with diabetes, that lens can swell, and then after they're treated and the blood glucose goes back to normal, that lens goes back to its normal size. So that effect on the lens can cause cataracts a little bit earlier in life.
Okay. Yeah. And I read too that people with diabetes are 40% more likely to get glaucoma. So what is glaucoma and why are people with diabetes more likely to get it?
Sure. Glaucoma is a disease of the optic nerve, and it's usually because of, or it can be because of, elevated eye pressure. And with diabetics, because it's a small blood vessel disease in the eye, when we have diabetic retinopathy, the ability for diabetics' blood flow to get to the optic nerve can be affected. So we do see a higher risk or higher prevalence of glaucoma in diabetics because of the blood flow perfusion issues to the retina.
Okay. So we already talked about why it's important to get a yearly exam, but why should people with diabetes be especially on time and making those appointments?
Well, the doctors around the Helena area do a great job in really pushing their patients to have exams every year, and it's important because diabetic retinopathy is a common eye disease amongst diabetics. After 20 years, almost 90% of those patients will have some type of diabetic retinopathy. So on a yearly basis, we watch for those kinds of things, and if we find them, then we have the ability to get them to a retinal specialist if they need certain types of treatment to help with vision problems associated with retinopathy.
Okay, and what is that?
Diabetic retinopathy? Diabetic retinopathy is basically just a hemorrhaging of the retina, hemorrhaging of the capillaries in the retina, and when that happens, we can have edema near the macula, and that can cause vision problems. That's usually what patients will notice. So, yeah, it's mainly hemorrhaging of the retina.
Okay. Is it pretty common among people with diabetes?
Yeah, like I was saying before, anybody that's had diabetes, even if they're well managed, after 20 years of just having diabetes, 90% of those patients will have some form of diabetic retinopathy.
Okay, and so what are the treatment options for that?
There's laser procedures that can be done. There are Avastin injections, anti-VEGF injections that can be injected into the eye to eliminate edema associated with diabetes.
So whether it's diabetes or something else, are there certain things that happen with a person's eyes that they should be on the lookout for, symptoms that might indicate either retinopathy or some other kind of eye disease?
Yeah, I think anybody that has changes in vision that don't get better, anybody that has discharge, red eye, new floaters, any new visual symptoms that don't improve, within 24 hours should see their local, optometrist or ophthalmologist for care.
And how urgent is something like that? Have you seen patients that should have come in earlier than they did, and what would your advice be there?
Yeah, unfortunately, quite often. So certain eye symptoms are emergent, and we get those in my office. We get those patients in that day. Some emergencies can wait a day or two, but my advice is if you're having new eye symptoms, you contact your eye doctor and see when you need to go in.
Okay, so let's talk about what people with diabetes maybe can do to help make sure that they put off some of those symptoms or those issues, or is that possible?
Yeah, the biggest thing is yearly eye exams.
Okay. And then what about people in general who maybe don't have diabetes? What are some general tips you could give those folks for just trying to keep their eyes healthy as possible?
Sure. I would say yearly eye exams would be a starter, just so that if there is a problem, you can catch it early. Lubricating your eyes with a good artificial tear, especially with all the computer work and the telephone use that we do these days, giving your eyes a break from some of those devices would also be a good idea for eye health. Those are probably the main ones. Sun protection too.
Okay,
Yep.
Sunglasses.
Yep.
Okay, and you mentioned the eye drops. So for people who are out there trying to find something like that, what should they look for or make sure that something does not have in it?
I would say, I have certain products that I prefer, but I would say if you go to your local eye doctor and they have eye drops there, those are probably good ones. But Sustain, Refresh, there's many to choose from. Anything preservative free is usually a good route to go.
Okay, so do you want to look for something that says it's natural?
Yeah, I would look for, I typically personally use preservative free artificial tears. They come in individual little vials. That's a good way to go for anybody that's a contact lens wearer or not.
Okay,
Yep.
Great. And so we're just about out of time. Any final advice you would give to viewers about eye health and keeping your eyes healthy?
I'd say protect your eyes with polarized sunglasses, and if you have any type of new eye symptom, seek care to your eye doctor.
Okay, perfect. Thank you so much. That's a lot of great information.
Thank you.
All right, we do need to pause here for another quick break, but coming up after this, we're going to talk about proper nutrition and how that relates to your eye health. Stay tuned. We'll be back in about 2 minutes. See you then. Welcome back to Healthy Living for Life. Joining us now is dietitian Jamie Larice, who is going to talk about nutrition and how it impacts eye health. Thanks so much for being here today, Jamie.
Thanks for having me.
So let's dive right in and talk about antioxidants and how they play a big role in eye health. Can you tell us what they are and how they impact our vision?
Yeah, so simply antioxidants prevent oxidation. So when you think of antioxidants, it's really easy to think of them as a compound that prevents rust. So if we think about our body and our eyes, especially as we age, as we are living our lives with air, with water, with soil, we tend to rust, much like other things. And so what antioxidants do, where we get them from food, is they prevent that oxidation. Why that's important is because oxidation causes what are called free radicals. Free radicals can be thought of almost like little Pac-Mans that are going into your body, and they're actually attacking your healthy cells because they want to take something from them. And so if we let free radicals go awry, what happens is our organs and our systems start to rust even more, and that includes everything, especially our eyes.
Okay, so let's talk about beta carotene. And so people have heard before carrots are good for your eyesight. Is that true? Is that the beta carotene? And can you talk about that?
Yeah, so antioxidants have a bunch of different classifications. What beta carotenes are part of is a class of compounds called carotenoids. So beta carotene is probably most notable as a powerful antioxidant because it's the most noticeable in orange fruits and vegetables. So when you think about carrots have the highest amount of beta carotene. Our bodies can't necessarily use beta carotene, so there's no supplement for beta carotene, but what it does is when we have enough beta carotene, it converts it into an essential nutrient called vitamin A. Vitamin A is then what helps to prevent the oxidation. Most notably, oxidation is seen in our eyes with macular degeneration and cataracts. So by having beta carotene in our diet, we get enough vitamin A, we help to prevent those eye diseases.
So you mentioned the orange. What other vegetables would you recommend for getting beta carotene?
I do recommend every sort of colorful vegetable. Everything works together, so beta carotene is going to work alongside a ton of other vitamins and minerals and other antioxidants. But what people can do is really look for those colorful fruits and vegetables. Most notably, beta carotene is a pigment that helps give color. So when you think about sweet potatoes or carrots or apricots, pumpkins, but beta carotene is also found in green leafy vegetables as well, like broccoli and spinach and kale. So when you think of any sort of powerful antioxidant, you just want to make sure that you have a variety of color on your plate.
Okay, great. And you mentioned vitamin A, but isn't vitamin E also a good one for your vision? Can you talk about vitamin E a little bit?
Yep, so vitamin E along with vitamin C are considered really powerful nutrients that also act as antioxidants. So if you think about the Pac-Man that I was talking about, this is a very large Pac-Man. Vitamin E can be toxic though if we take it in supplementation. So when we think about foods to ingest with vitamin E, if we have a nourishing diet that is built upon the 5 food groups, you probably won't have a problem ingesting enough of these nutrients. But if you think about sunflower seeds, almonds, even whole grains, a variety of those foods will have high amounts of vitamin E, including things like eggs.
Okay, and you threw out vitamin C too. What kind of food should we be eating to get our vitamin C?
The easiest way to get vitamin C, which is one of the most powerful antioxidants along with vitamin E, are fresh fruits and vegetables. We have to be really careful though with vitamin C, especially in supplementation form, because vitamin C is really heat sensitive. So having fresh fruits and vegetables is a surefire way to know that you're getting enough vitamin C. Really easy, the plate method. Half of your plate should be fruits and vegetables. If you know that you are doing that on most days and that's a pattern of eating, you have no problem getting enough vitamin C.
Okay, cool. And you talked about vitamins. Let's now go to minerals. Can you talk about some minerals that we should be thinking about when it comes to our eye health?
So one of the most important minerals as it relates to eye health is zinc. The reason we know that is because when we look at the health of the retina, there's a lot of zinc already in our retina. So we know that having zinc is important to eye health. We often don't get enough zinc because we have a lot of food aversions. Food, especially for like vegetarians, people who don't eat meat, people who don't eat seafood, those are going to be really good sources of meat. They're not the only ones, but those are your highest sources.
Okay, and so you just mentioned seafood. Are there minerals or vitamins in seafood and fish that we should be trying to get into our diets for our eye health?
Yeah, so not only, like I mentioned, do fish and seafood have high amounts of zinc, but omega-3s, which we know about, are not only important for heart health, but they're important for eye health. The retina especially is shown to have high amounts of omega-3, which is a fatty acid. Fatty acids are important because what they do is they repair our organs and cells. So as we're going through life and we're naturally rusting, suffering from oxidation, including omega-3s in our diets helps eye health because that's already present. So when you think about omega-3s, especially here in Montana, trout. Trout has, everyone thinks salmon, but trout has really high amounts of omega-3s. But alongside trout is salmon, and we also have flaxseed and walnuts that contain large amounts of omega-3.
Okay. So if someone is not necessarily getting these vitamins or minerals because maybe they don't like some of those foods, do you recommend supplements?
You know, as a dietitian, we always want to go with food first. So if someone is not including a particular food group, the first thing I would do would be to go talk to a registered dietitian, only because they could then think of different ways and different foods to get that in. If it's not salmon or trout, can we include flaxseed or walnuts or fruits and vegetables in another form? Supplementation is really designed for a deficiency. Supplementation can be used most notably when someone already has a condition like macular degeneration or cataracts. We really want to do food first because that's how the body will recognize it, especially when it comes to vitamin E and vitamin A, which are both fat-soluble vitamins. People who supplement have to be very careful because those over-supplementation can be very toxic. In another sense, supplements are not regulated by the FDA. So what we want to do is make sure that if we're going to take supplements, we are using them food first. For instance, cod liver oil. We can't get cod liver oil just in the grocery store. We get it in a supplementation form. So going to talk to somebody like an MD or a naturopath or a dietitian, food first, and then we can supplement otherwise.
Okay. Awesome. That's all the time we have. So we got to stop there, Jamie, but thanks so much. A lot of great information.
Yeah, you're welcome.
And I would like to thank Dr. Nottingham for being with us today as well. And thank you so much for tuning in. We hope to see you next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.